I'm Dr. Alex Chan, naturopathic doctor. I've been in practice since 2012 when I joined the practice first as a resident physician. Integrative has had a long history in Vancouver, started by my father, Dr. Lawrence Chan, and his two partners, Dr. Hal Brown and Dr. Eric Posen. In my practice, one of the things that's become really important is looking at health optimization and longevity and how we can actually start looking at these things earlier. Because as I was finishing my naturopathic medical training, I was 25, I decided I should do some screenline basic blood work, just get a sense of where I'm at right now. And I ate pretty well, I exercised, body-wise I looked pretty much how I look right now. And I was shocked. My numbers came back, I looked pre-diabetic. And I thought, wow, I must be missing something in this. So I dived in, I did some more specifics in terms of changing my diet and changing my exercise regime a bit more drastically, doing a bit more complex testing that was beyond the baseline screening testing that you might initially think about for someone at age 25. And those changes have made, in 2 years, made a drastic difference where I no longer look pre-diabetic. My numbers have been super stable since, and it helped prevent what likely is in my genetics as a predisposition that if I didn't know about, if I didn't start testing until I was 35, 40, would probably have already developed into a full disease course. And now I've been able to have that preventative action. So with my patients, that health optimization and longevity focus, I think, is such an important part of my practice. A lot of people ask me, what's the right diet? What's the perfect choice of what they should do nutrition, exercise-wise? And unfortunately, there's no simple answer. So at the time when I did blood work and found out that I was pre-diabetic at 25, I actually was just kind of eating a well-rounded, what you would consider, vegetable forward, some protein, a decent amount of carbohydrates, both like rice and potatoes and breads, pastas, those types of things, and then doing kind of general fitness and exercise. When I got the news that my markers with that type of lifestyle looked not great, I did some more genetic testing that actually showed that I don't burn carbohydrates very well. My body's really carbohydrate insensitive. So that means that I eat carbohydrates, they spike my blood sugar more than they might the average person. And I also, my body favors different types of activity. I'm not as much an endurance athlete. I'm more of like a sprinter or a power-based athlete. So that really changed what I did in terms of my own personal health plan. I actually went full ketogenic and then from ketogenic to paleo, so really low carbohydrate intake for a good period of time, and was very, very strict about that. And then after that, since that time, now that I've gotten some of that under control, and I also changed my athletic pursuits, I've been able to introduce some of those other carbohydrates more gradually and had better tolerance, but I know the triggers. So there is no one size fits all when it comes to nutrition. You have to actually look at certain specialized food sensitivities, allergies, or genetics to really determine what the right fit might be for you.